I'm going to give this a little more time. I know it's a little after 5, but I think we should wait a little bit for more people to sign in. So please be patient, and we will start the program in about 3 minutes. Okay, I'm going to start the meeting because I don't want to, I certainly want to have plenty of time for our speakers this evening and a lot of time for questions and answers. So welcome, everyone. Thank you for joining us. This is, I think, going to be a very good, informative program. I know you're going to learn a lot. The 2 people that are going to be presenting are both people I know well, and I know Dawn has a wonderful story. I actually knew Dawn back when she got her kidney transplant, so we go way back. But I want to just thank you again for joining us. If you have any questions, please put them in the chat box, which is at the bottom of your screen. And we will answer the questions at the end of the program. There's plenty of time for questions, so please ask them. Some of the other programs we've done, nobody asks questions, and nobody's going to learn if you don't ask questions. So there's a lot of information to cover, and there's a lot of information that goes into, getting a transplant. So please feel free to ask any question. There's no such thing as a stupid question. Everybody tells me that. So anyway, without further ado, I would like to introduce Dawn Lawlor, who is going to tell her story of her journey to get a transplant. Dawn?
Thanks, Marcia, so much. I really appreciate you having me here. It's exciting for me to be telling my story to all of you, and hopefully it will help you on your transplant journey. I also want to just noticed Marcia today because she said she's known me since my first transplant, which was back in 2000. And she's actually with the Kidney Foundation 24 years. And so we just want to acknowledge that and let her know that I'm so grateful for everything that she does for us kidney patients. She's made quite an impression. So I'm basically going to tell my story today. I've had 2 transplants, each of which were very, very different, which I'm sure Monica would agree that each transplant is unique, and each patient is unique. So basically, I found out that I had kidney disease when I was 14 years old. I was diagnosed with polycystic kidney disease, which I inherited from my dad. So when I found out, being as young as I was, I don't know, I guess I wasn't really affected by it that much. I was young, I felt fine. And even though my dad was on dialysis my whole life, he was a liver. So he was very grateful for dialysis, and he never really let us know that he was sick. So I always thought that I would be fine. And in the end, true, I've been fine. So basically, at the end of my nursing school journey, I started to not feel well. So at that point, I was in my early 30s. I was married and had a son at the time who was young. I was in nursing school and found myself very tired, not being able to concentrate, a little distracted during my clinicals. And I just contributed that to the fact that I was working very hard in school. I had a family, I was up late studying. But in reality, it was from my kidneys getting worse. So I had a routine visit with my nephrologist. I went to see him and I had blood work done. And he said, Dawn, you know what? You're really, really getting to the point where you need dialysis. My creatinine at that point, I think, was somewhere around 8. And I knew that that was bad, but I had to finish nursing school. So I kind of brushed him off. I told him I was fine, a little bit in denial about that, but I was so close to finishing that I needed to finish. So I did struggle through and make it, and took my boards and got my RN. That was back in 1999. I went to work at a hospital, got a job, and about 3 months into it, I was really, really incredibly sick by then. So I had to leave work, went back to the doctor, still was not crazy about going on dialysis. So I said to him, I'm going to wait a little bit, and then when I'm ready, I'm going to call. So at that time, he said, listen, I think it's important for us to also get you listed for transplant. You can, even though you're not on dialysis, you can start your evaluation now. You can go, you can meet with the transplant team. You can find out what you need to do. We'll get some testing done and we'll go from there. So that's what I did. I remember I had a couple of tests back then. I saw the dentist. I had some cardiac testing. I think I had an echocardiogram, and they of course did the blood work. But since I was so young and had nothing else really wrong with me, the testing wasn't extensive. And so I was listed fairly shortly after that. I would say just a couple of months actually. So my thought was, I'm going to eventually have to start dialysis. I'm going to be on the transplant list and I'm just going to wait. Don't remember back then how long the wait was, but 4 to 5 years is kind of coming to me. So I actually hadn't gone on dialysis. This is maybe a month later, and I got a call from the transplant center and they said, Dawn, we have a kidney for you. And I thought, how could they have a kidney already? I just went on the list. They said, well, actually, it's we have a living donor. It's your girlfriend, Claire, who just called the center and said, my friend is sick. I want to get tested to give her a kidney. I had no idea it was even going on. So that was just, I was almost in shock with that because it totally turned everything upside down for me. So now I'm thinking, wow, I could have a kidney. like within weeks, because they told me, well, you know, you guys will have to meet with the social worker and speak to her, both of you. And then once you're cleared, we can schedule a date. So as I thought about that, after thinking, oh my God, I'm going to get a kidney, I'm thinking, wow, how do I feel about this? Because now I'm not dealing with a person who has died and wants to donate their organs. Now I'm dealing with someone who's living, is young, is a mother. And it was hard at first. I had to kind of think about it. We had a couple of conversations on the phone. And then we both went and did meet with the social workers, and we decided we were going to do the surgery. So it happened pretty quickly. So this was January 2000. We both go in, we do the transplant. It's very successful. We're both doing well. It was a little hard on Claire because back then they weren't doing the transplants laparoscopically. In other words, the small instrument that they go in and you just have a couple of small cuts to, remove your kidney to donate. This is a huge surgery where they pretty much cut you in half and take the kidney out. So she did have a long recovery, in fact, much longer than I had. My incision site, or the length that they cut me, was, I don't know, maybe 4 inches or so. It was very small in the front, to the right side of my belly. And they told me that the kidney was connected to the veins and arteries in my leg. So I did very, very well with that kidney for 5 to 6 years. So now we're into 2006. I'm doing well. There were some bumps along the way in that my creatinine was bouncing up and down. I was still having some urinary tract infections from my polycystic kidney disease. And the meds that I was on, of course, 20 years ago, very different than what I'm on now, but they weren't as effective, and they were trying to change the medications for my kidney to do better, but it was kind of rocky for the end of it there. So I kind of had like a slow chronic rejection with that kidney. So at that time I was working, and I was actually working for the organ procurement organization in Connecticut. So in other words, they're the ones that go out and work with the donor who has died and has said, I'm going to donate my organs. So that's what I was doing. I started to have the same type of symptoms that I had when I originally went into failure. I was tired, wasn't sleeping well, had a terrible taste in my mouth, and I just wasn't doing well. So I actually was in Washington, D.C. at the time, doing something like this, giving a talk on transplant. And I was working for the OPO, and they sent me to the hospital in Washington, D.C. And I found out that my creatinine was 5. So I knew that the kidney was failing. So I came back here to Connecticut, and they admitted me to the hospital, and they pretty much just went to heroic lengths to try to save this transplant. I did plasmapheresis, which is similar to dialysis, where they take your blood out of your body and they basically take all of your antibodies out so that there's nothing of your own body that's fighting the kidney anymore. They gave me all kinds of medications, steroids, everything they could, but it just never got better. In fact, it got to the point where it rejected so badly that I had to have it surgically removed. So after that surgery, the surgeons pretty much said that they thought a large part of the problem with the first transplant was that my old polycystic kidneys were still in. So if you don't know about polycystic disease, it's basically where these cysts grow over your kidneys and they become just engulfed with them, and the kidney is no longer able to work. It takes over the good tissue, and now you're loaded with cysts. So if you think of what your normal kidney is, which is the size of your fist, my kidneys were the size of footballs. So my abdomen was way out front and I looked 6 months pregnant all the time. And they were painful. So the recommendation was, let's take those kidneys out. So I had both of those kidneys taken out in one surgery, and then we'll think about another transplant. So I had that surgery in April, and then my sister Carolyn came forward and said, it's time for me to give you my kidney. And what was amazing about it was there was only the two of us in our family. And for polycystic disease, you have a 50-50 chance of getting that gene. So there were only two of us. I got it. My sister did not have it, but she was a perfect blood type to me and tissue type, like if we were twins. So it just turned out to be amazing. And for her to do that was just amazing. So after the April surgery, I healed up, and June 1st, that same year, my sister donated her kidney to me. And that was 15 years ago. And this transplant has been totally different in that the medications are much better now. I've been on the same meds that I was on when I first got the kidney. I'm on the same meds 15 years later. So there was no up and down. I started the transplant right after with a creatinine of 0.7, and the highest I've ever gone is 0.9, which is a normal creatinine for a normal person. So because of that, I've been able to keep working as a nurse and doing what I became a nurse to do, and that's to take care of other kidney patients. So after I had that transplant, I pretty much quickly went back to the dialysis unit and started working as a nurse, doing dialysis. And I've been doing it ever since. So now I've actually moved into a position where I do patient education and teach people about kidney disease, the types of dialysis they can go on, and get them and help them get listed for transplant. So it's been a long journey, and at times it's been very difficult, but there's no treatment like a kidney transplant. Going through the referral process, the testing, having the surgery, the challenges with the medications, they all seem minute compared to the quality of life that you have. I mean, I have plenty of friends that don't even work near the amount of hours that I work, and aren't near as happy as I am. So even though people would say, you know, my gosh, you've been through so much, there's many things that I've learned, very valuable life lessons. The first one being that when you need something like this and you're ill and the chips are down, you see who steps up for you in your life. And that is priceless about it. Or if you're someone who receives a kidney from a donor that has died and wanted to donate their organs, that's a special gift that you're getting, either way. So taking that gift and then just using it to live the best life that you possibly can, that's my best advice. If you are a candidate and you can get a transplant, it's definitely the treatment that you should be concentrating on, and using all the resources and all the people around you that can help you. So I know that we want to talk now about the process for you to, think about a transplant. What do I have to do to get listed? Am I a candidate? Do I want a kidney transplant? All of these things are, I'm sure, questions that people struggle with every day. So Monica is on the line, and she's a transplant coordinator with one of the hospitals in the area. And she's really a plethora of great information, and definitely should be directing some of the questions to her. So first thing we talk about is, do I want a transplant? So I know everyone's different how they feel about a transplant. Yeah, should I be scared of it? How is the surgery going to be? How am I going to feel with someone else's kidney in my body? How do I feel about taking a kidney from someone else, whether it's living or someone who's died and wanted to donate their organs? Those are all things that people struggle with, and everyone has different feelings about it. I worked with many families when I was a transplant coordinator who ended up having their family members donate organs. And it was a great comfort for them knowing that they were going to, their loved one was going to save someone's life. So whereas it's very difficult, I think that that's the purpose. And when we think about what we can do to help each other, and if you can make a difference in actually saving someone's life, that's what they want to do. So if a kidney transplant can help you live a better life, live longer, live happier, you should take it. Should take it. That's my best advice. If there's a person in your life that wants to donate, I had to deal with that twice and thinking about how that was going to affect those people. I think just knowing that they want to help you is a big deal, but just explaining to them how you feel about it and what it can do for you, and also how they feel about it and what it can do for them. People don't usually volunteer unless it's something that they really want to do and they're doing it because it can save your life. Monica, what do people tell you when they come to the transplant center and they want to be a donor?
I don't work with the donors. However, in working with the recipients, I can tell you most people with renal disease find it very, very challenging to ask someone or get the word out for a kidney transplant. And like you made so many great points, and one that really jumped out is the sometimes feeling of guilt of not wanting or deserving. And it's hard for many patients from different cultures or beliefs to accept that gift. They feel that it's overwhelming, but you would be surprised if you can get the word out there. And we have a living donor contact who helps the patients do that. I had one gentleman who wanted to see if he could get a living donor, and within 24 hours, over 20 people called the center saying, I'd like to be a candidate. So don't be hard on yourself if you have renal disease and you don't know how to get the word out. There's people, places, and programs in place to help, because of exactly what Dawn said. A lot of people feel funny about it. People want to help other people. It's in our nature. It's in our genes. And it is a gift. And 99% of people understand that and want to move forward. And, you know, we're here to support them in doing that.
Great. And I think it's important people to know that kidney transplants are, they're pretty much low risk, because whether you're the recipient or the donor, you have to go through extensive testing to make sure that you are in good health and you're able to get the transplant. So the risk is low compared to other surgeries.
Monica, do you want to talk a little bit about the stages that people will go through when they come in to sign up to?
So the first step is even actually before you come to us. So if you're seeing a nephrologist because your kidneys are failing, do know you can be referred to a transplant center well before when you might actually need it. And we stress this because, like Dawn had said, the wait times vary depending on your blood type and other factors. So if you know you have renal disease and you know you might at some point need a transplant, talk to your doctor now. You can be referred, you can be worked up, and there's a goal where when you can be listed when one of your lab values hit a certain number. It's your eGFR. It's just basically how your kidneys filter out your urine and your blood. When that decreases, once you hit a certain number, let's say 20, you can actually be put on the list once you're 20. So as you're getting closer, we can kind of anticipate that. And if you have a living donor, we're pretty good about gauging when you would need it to where we could plan a living donor transplant so you would never have to see dialysis in many cases. But that can only happen in the early referral for evaluation or to talk to someone about transplant, because like Dawn said, the workup is extensive. The evaluation, you first have to call, and then we have to make sure that you're financially cleared. And it's not just for the transplant, but the medications you're on lifetime after transplant is the critical part. And if you don't have a proper insurance coverage to pay for those medications, you wouldn't be able to afford those medications that keep the kidney alive. So that's the first step. And our financial coordinators work with people to help them. Once you're cleared and just to be evaluated for transplant, you come in and it's about a six-hour day where you meet with the whole team, a coordinator or surgeon, the nephrologist, transplant nephrologist. It's a whole team because we want to make sure everything's okay. And like Dawn also said, we want to make sure you're healthy enough. And depending on your age, what your disease is that's causing renal disease will drive what further testing we need. Polycystic kidney disease, PKD, is probably one of the easiest and the nicest diseases to work up because they're the easiest. They're otherwise healthy. They just have a bad gene and they've got big kidneys and occasionally a big liver to go with it. However, the diabetes and high blood pressure, which are the top two causes for renal disease, come with a lot of other diseases that you can develop that we have to make sure aren't going to impede on a transplant or make it a higher risk. And we do a very, very thorough workup ahead of time. And then depending on how involved someone is how quick you can get on the list. So there's several steps. And then once you're approved and on the list, like I said, the wait times vary. Some people just can't handle the long wait, so they push for a living donor. And that's where we have these living donor advocates or people who that's all their job is, and they help walk you through that process. And it really is successful. And if you do need a kidney, you don't need to worry about blood type. You just say, hey, you want to donate a kidney, call this number. They'll do the screening to see if they're eligible. And if they're not the right blood type, they can go into a swap to where there might be other people in your situation who have a donor. However, they're not a match for their loved one, but they might be for you. So they can do the swap. Or we could do a national chain, which I've been fortunate to be part of from California before I moved here, where one person donates to someone else and so forth. And where we did, I believe, we were on the receiving end of the 25th person in California. This started here on the East Coast. So as a person with renal disease, you don't need to worry about all the facts. You just need to supply a phone number. And, there's a few things I always tell them. They just can't be morbidly obese, very large. And we don't want to take a kidney from someone who's a diabetic, but you don't need to screen them to ask them what their history is. That would be our job. But if you happen to know, those are two things that we're going to say, hold off on. But we're here to answer any and all questions for anyone, whether it's for a friend, themselves, or for future needs.
Monica, I do have a question in the Q&A box, and I'd like to read it to you because it's sort of what we're talking about right now. She said, how often do transplants fail? I'm going next week to get tested to be a match for my mom, who has been on dialysis for the last few years, and I'm nervous about the success rate.
That is a great question. I personally have seen when they're blood relatives, it tends to be a better and last longer. And first, second of all, living donors tend to last longer than deceased donors, start to work faster and last longer. However, there's no guarantee. And this is where it goes into what Dawn was alluding to at the first one. We do check levels and we adjust medication accordingly to make sure that levels aren't too high and they're not too low. I've also seen where a living donor was given to someone and the body, it should have been a perfect match, but for some reason the recipient's body didn't like it. It's hard to say, but here we have a perfect example with Dawn. She's going on 15 years of her kidney, but yet her first one only lasted 5 years. It all comes down to compliance with the medication. first of all, it goes with how compatible you are. So like Don said, not only was it the right blood type, but when we check your blood, we know what your blood type is, A, B, O, etc. But then we further break it down to see what your blood is made up of. And those items, everyone is like a bingo card, a little different. So if your bingo card is very close to the recipient, you're going to be a better genetic match, hopefully less chance of rejection. So you giving to your mother would be a better chance, but then your mother probably has antibodies, which are things your body develops when you're exposed to another person's blood makeup, like getting pregnant. You're exposed to another person's blood makeup. Your body sometimes, we don't know why, it fights that person's blood type, so it makes antibodies against their antigens, what their blood's made up of. So the more difference there is, the more challenge of rejection. However, medicine's come so far, we can usually foresee this, and we suppress your immune system, and we can follow it with biopsies. So they've come so much further. The fact that you're willing to step forward for your mom is phenomenal. I would be surprised. I would be more concerned if you weren't nervous. But in saying that, I would say know that you're in good hands, because everyone wants a successful transplant, including the donor. And they do everything they can to prevent it from rejecting. And like, you're in good hands, and they're going to be very upfront with you.
Monica, I've got another one, and I know we were going to wait until the end, but I think, it's maybe addresses things that are going on right now. So this person asked if you can speak to the value of social media in finding a living donor.
Oh my gosh, it's huge.
Huge.
It is. Even before I came here, I've been in my current role for 7 years. And then prior to that, I was a bedside nurse on a transplant floor in California for 7 years. I was an old nurse. And social media, even back then, was huge where it helped. But our program where I'm at has adopted Johns Hopkins template. We've gotten permission to use their template to where our living donor outreach person will talk to people. If those people don't want to go on Facebook themselves and say, hey, I need a kidney. If you're interested, call this number. Basically, that's all you need. However, what's helpful is introduce yourself, how your renal disease happened. If you have a family, you're married, you've got kids, grandkids, what you hope to obtain by getting a transplant, seeing your grandkids grow, seeing your kids grow. It's huge. I can't tell you, we've had thousands of people step forward for various donors based on posts on Facebook or Instagram. I've even seen billboards. I've seen movie theaters. So if you don't have a friend who can get the word out there, I would recommend talking to the transplant center to see if they have someone who helps work with patients to get the word out. And they have so many tips and tricks. It's huge. I don't like to say it's huge, but it's huge.
It's huge.
Well, it really is. And it does. We had a patient here that got listed, and she was expecting to wait 5 to 7 years. And she had posted it on Facebook that she needed a kidney, and it showed up on her friend's page. And some woman must have looked at it and just walked into the transplant center, and not specifically for this patient, but just walked in and said, listen, I'm healthy. I have 2 healthy kidneys, and I want to donate a kidney to someone. So it was totally anonymous. But if she hadn't seen some of these posts on Facebook, she might not have known that people needed kidneys. So you don't even necessarily have to know a person. Some people just want to do this as an altruistic gesture and know that they're going to help someone out there. So it's really amazing what social media can do.
It happens more often than not. I've seen people give, I don't know if you've seen the news media where a gentleman gave part of his liver to a child and then gave a kidney. And that was on the media. I've seen people come into my center who have done the same thing, and it just absolutely amazes me. It's just incredible.
Oh, we have another question. We're really on a roll.
Keep them coming.
Yes, keep them coming.
Come on, guys.
My first kidney transplant came from my mom in 1982, and 42 years later, I'm with the same kidney, being that it is 84 years old. My kidney creatinine just started going up to 1.3. I was told that I will get bad right away. Thank you very much for such valuable information, because it has been a long time since then. I relate to Dawn with her first surgery. Did you follow that, Monica? Would you like me to go back?
I'm unclear as if there's a question.
I'm a little confused. I was having trouble reading it. She got it from her mom in 1982.
Mhm.
And 42 years later, she's with this, she has the same kidney. So my
But
kidney,
1.3 is not a bad creatinine. So
Right.
that's, I guess that's where my question is.
but she was told it might get bad right away. That would, yeah,
Oh, as far as rejection.
yeah, yeah.
It
That's
would all depend on, it's kidneys can get what's called an acute kidney injury, an AKI, whether it's your original kidney or donor kidney. And if you get food poisoning and you get diarrhea or you get vomit, or in this weather that we have, this beautiful weather out there, if you
Dehydrated.
get dehydrated, it can actually hurt the kidney to where that creatinine can go up. Or if you're eating, if you're eating foods now, so the person who's had the kidney for 40 plus years, if you can think back, and if not, Marcia's your contact for this. Think of the diet that you were on when your kidneys first were starting to fail. You were on a renal diet. And that is specifically so that your kidneys don't have to work harder and hopefully last longer. So right now, as a nurse, I would recommend someone stay hydrated, watch what you're eating, and if you're overweight, try to lose weight, but just stay hydrated and watch your diet. Those kidneys can always turn around and come back to normal. The creatinine can go up and down. You can have a creatinine up as high as 4 or 5 and still not need dialysis. Every person's body is different. The fact that you've had this kidney 40 years speaks volumes. So I'm wondering, have you been sick recently or such?
Can I ask her, Marcia, like what her last creatinine was? Is the 1.3 a big change from the previous?
Yeah, let's see. If she answers, let me get on.
She's way out of her norm. Because,
Yeah.
Sometimes mine, if it's normally 0.7 and I go up to 0.9, my nephrologist has told me, listen, sometimes it's just the fact that you may be dehydrated at the time that the blood was drawn. So I'm just wondering what her normal creatinine has been running.
She also says she still takes prednisone since 1982.
So do I. I've never come off of the prednisone. I'm still on it, or 22 years.
All right, we got one here. Hold on.
Which I'm reminded of when my knuckles start to bother me.
Marcia, I can actually see her questions and responses as well.
Oh, okay.
Oh, you can.
Yeah. So again, your
Okay,
weight
here we
obviously is good, you're organic, etc. 40 years, oh my gosh, that's just phenomenal.
That's amazing.
And just keep listening and don't be afraid to ask questions. Also, if you're asking what the creatinine is, I would say ask them what your eGFR is, because it's not just a creatinine, but it's also your GFR, because that's going to tell us how well your kidneys are filtering out the stuff. Me as a 61-year-old, as we get older, our bodies break down and things get hard, and it's just the way it's life. So if they were to do a biopsy on my kidney right now, they're going to see some sclerosis. If I get dehydrated, my GFR can sometimes drop down. But if I drink, everything's fine. As opposed to someone who's in renal disease, their GFR, their kidney biopsy might look a little bit worse because they have known. So the GFR will tell us how well that kidney is functioning along with the creatinine. I always like to look at both numbers, because the GFR will drop suddenly. I've known some people who needed dialysis when the GFR was in the high teens, low 20s, which is not normal. Most people can avoid dialysis until their GFR is down in the single
In
digits.
singles.
Everyone's different on how they respond to the toxins build up in their body. But those two tend to go hand in hand, GFR and creatinine.
Right.
Okay, I don't think we do have another question. Monica, you want to take it or?
Sure.
Oop,
Uh,
find it?
Yeah, they keep coming in, which is great.
Oh, this is, yeah, it's great.
So her creatinine was 1.1, it's now 1.3. So yeah, and then she goes on, she almost fainted at work the week before, but stopped drinking water. Again, yes, I find that I have to drink more water. As we get older, our body needs different needs. So you have to adapt to what our body requires.
I'm trying to get in and look at these questions.
Yeah. Did you see another question, Marcia? I'm not seeing another question.
Hold on. I've got to go down the screen.
Oh, I
because-
see. What's the average recovery
Right,
time for both the
okay.
donor and the recipient after transplant? We like to get, so like Dawn had said, as far as recovering a living donor from a kidney from a living donor, they tend to have more pain in the beginning historically, but we now do blocks of the nerves around that area so they're not experiencing it. Living donors tend to go home sometimes as soon as the second day. We've shortened our inpatient time, if at all possible, to where people receiving the kidneys, if all goes well, we'd like to get them home by the third day. We used to say 4 days, and that's twofold. You're in your own environment, you're safer, less chance of catching something also. With COVID out there, COVID's still out there. It's still, people are getting it pretty significantly. But on average, it's about 3 days for the recipient and usually about 2 days for the donor on average, if everything goes good. Might be a day or so more on either end of both.
Okay, actually, the next question I can answer. It's not medical. The person asked if he lives in New York, or yeah, they live in New York, and they wanted to know if this was being seen in other places. Yes, this is actually coming from Connecticut. We just included New York. It's the Connecticut and New York, Greater New York are combined and work together very closely on our programs and our events. So we wanted to include New York in this program. So thank you for joining us from New York. Okay, I don't think we have any new questions.
On that New York note, you can be listed in different transplant centers if your insurance doesn't have a problem with that. And you have the ability to travel to that center, because wherever you're transplanted, you're followed up twice a week the first 4 weeks, as far as our center, then once a week for 4 weeks, etc. However, some centers do televisits, and they have changed the allocation for the deceased donors to where it's now distance from the center. So it can be very beneficial if you can be listed at multiple centers as well.
I'm sorry, I don't know if it's a he or a she. They are a recipient already for years. So
I see that.
Wow,
yeah.
great.
So yeah, I forgot to mention that. So, oh, we have more. Oh, I'm so excited.
Oh, I like the BMI one. So to the anonymous attendee, our requirements in our center, and I believe they're pretty much the same national, there are some that are more, we prefer the BMI of the recipient to be under 40. However, if you carry majority of your weight between your breastbone and your belly, all in your abdomen, like the spare tire, they might want you to lose the weight, because the more adipose fat tissue you have in the lower right groin area, the deeper the incision, the higher the risk of infection. As far as donors, where the donor can't be more than a BMI of 35, because again, the higher the BMI, the higher risk of infection, slower healing, more complications.
And then there was another one. Can you see that one?
Yes, what does it mean when the neutrophils are way high? My doctor stated I should watch for cancer. I already had breast cancer. Okay, this is way out of my league.
Yeah,
This is more of a physician type of question. And anyone who has a history of cancer, if they are on immunosuppressants, I don't know if you need a kidney or if this is just information for you. But anything abnormal, we put a stop on everything and make sure it's worked up. And the reason being is if there's even a slightest thought that someone might have cancer, or if someone has a history of cancer, we look at how long it's been since they've had the cancer. And then we look at what type of cancer, and we look at the staging of the cancer. Those factors play in for recipients because they have to have a cooling off period. If we were to transplant someone, we give you immunosuppression. The medications we give you wipes out your immune system to where if you had any dormant cancer cells, it would automatically activate them. And once the cancer is developed in someone who's immune suppressed, it's a very short lifespan. So we always tell people with any question, it has to be completely worked up and evaluated, and then there's a team discussion.
yeah, I think
Yeah.
Monica, this is the lady that's had the kidney for 42 years.
Yes, you're right.
This is the same, yeah. So,
We don't have any other questions right this minute. Monica, do you have anything more you want to talk about?
I think someone just popped in a question. It just jumped up to 12.
Yes, you're
yeah,
right.
it did. It's Tanya again.
How effective is the home dialysis? So I'm assuming by what I'm reading, you're talking about peritoneal dialysis. And if I ever needed dialysis, I would say I would want to do the peritoneal. It's very minimally invasive. Plus, I love doing it on patients when I worked on the floor. It was just fun. I'm a technical person. It's very effective in majority of people. There does come a point where sometimes the peritoneal dialysis doesn't work anymore or as well, and then the person has to transition over to hemodialysis. In my own personal experience, I see this in the patient population who tend to be at a higher risk for coronary artery disease, high blood pressure, diabetes. There's a certain patient population that unfortunately are much more higher risk for things. And if they have uncontrolled high blood pressure, a lot of times peritoneal dialysis won't be as effective as need be, because it works great in majority of the people. But if things are uncontrolled, you need a hemodialysis that works better. And you can't, because it actually filters the blood. You can do home hemo if you have the right space, if you have the desire, if you're not squirmish with sticking yourself, which I've had a lot of patients absolutely love. But the peritoneal dialysis with the port in your tummy, I think is a phenomenal way. And if it was an option, I personally would choose that.
Yes, I agree. I'm also a home nurse. I've been doing teaching home dialysis to patients for the last 10 years, both PD and home hemo. They both have their advantages. And if you get to the point where your transplant is failing and you need to go back on dialysis, in-center really should be the last resort. Would definitely try to do PD first. You can do it at home without a partner. It's very comfortable. You do it while you sleep. And then if that isn't a possibility for, a variety of reasons, you can always also check into home hemodialysis, which now can actually be done solo also. So there's many possibilities as far as home, but would definitely recommend home over in center if at all possible.
I see Tanya mentioned your high blood pressure. I'm talking uncontrolled high blood pressure where their top numbers consistently close to or over 200 and the bottom number is constantly close to or over 100. When those numbers are that high, more often than not, that's where we call uncontrolled high blood pressure.
Right.
Okay. I want to tell everyone also that this has been recorded. So if you've missed any of it, please get in touch with me. You should all have my emails if you still have the invitation, but if not, it's Marcia, MARCIA .Hilditch, HILDITCH @kidney.org. I'll put it in the chat box too. Also, anyone in Connecticut who would be interested in joining our walk, which is October 2nd, you might have noticed the rather large orange arch in the background that says Backwards Kidney Walk. We have our walk coming up at Hubbard Park on October 2nd, which is a Sunday. So just reach out to me and I'll get you all signed up. So I've said my piece for that. Oh, we got more questions too. Sorry. Go ahead,
okay.
Monica.
I think we're good.
Really?
Got it.
It's
Yep.
just Tanya thanking us. Anytime, Tanya, we're
Oh.
happy to help.
We're so happy to help.
Yeah, yeah.
Thank you all again for joining us. I think this has been a really good session. I think having two very experienced people on the topic as our speakers is great, because there's so many questions and so many ins and outs to all of this, as you're all finding out. So anyway, it is almost closing time, and unless we have any more questions, or if either one of you have anything you'd like to say.
I just wanted to share that Marcia, working with NKF, does put many of these on throughout the year. Different topics, but yet all somehow related to kidney. So keep in touch with Marcia, future talks going on. And if you have specific questions, she knows how to reach us and everyone, but also the future talks are very educational. So keep your ear to the ground.
Great.
Thank you. All right. Oh, we got another. Do we have another question?
You got a couple more.
She's just telling us we're wonderful.
Yes.
We like that. We like that.
Thank you,
Thank you.
Monique. Actually, that's Monique in New York, who also
Yes.
does patient programs. So
Aw.
that's good. A very good thing. Thank you, Monique. I'm glad you could join us. Anything else?
And to everybody out there, don't be afraid of transplant. I know it can be very intimidating when you think about, the whole process, and even when you think about if that's something that you really want to do and how you feel about it. But I would encourage you to reach out to all your resources and get educated and make your decision after you've been educated and you have everything you need to know. And then just know that the benefits way outweigh the risks in most cases. So if the transplant center is evaluating you and saying that you're a candidate, that means that they've looked pretty much at everything. And you can be confident in knowing that you're going to have a good chance of doing well. Transplant has come a long way. And it's something that you really should consider and take advantage of so that you can have your best life and live your best life. Thanks so much to everyone.
Thank you, everyone. And again, if you have any questions, you can find me at marcia.hilditch@kidney.org. Thank you and have a good evening. Thank you,
Thanks,
ladies.
everyone.
It was
Thank you,
fun.
Marcia, for having us. And
Thank
thank you, people, for attending.